Etanercept is a biologic fusion chimeric protein TNF inhibitor. Fusion protein is the combination of separate genes to produce a single polypeptide during transcription and translation. Etanercept consists of two TNFR2 fused to the Fc portion of human IgG. It is a soluble receptor that inhibits the inflammatory response in joints and skin by binding TNF-alpha and blocks the elevated inflammation in conditions like rheumatoid arthritis, psoriasis, and ankylosing spondylitis. Unlike other anti-TNF drugs, etanercept is a large complex glycoprotein that has a dimeric structure, allowing it to bind TNF with affinity that is 1,000 times greater than the natural TNF receptors. Another advantage of etanercept is that this drug can be self-injected with an auto-injector at home with an appropriate training. So the most common side effects of this drug are infection and injection site reactions. Moreover, compared to other TNF inhibitors, etanercept has the least immunogenic effect. A recent study by John von Bremen Research Institute also suggests that etanercept may have a beneficial effect on cardiovascular disease by slowing the progression of carotid intima mediate thickness in patients with ankylosing spondylitis. Adalimumab, also known as Humira, is a monoclonal humanized antibody produced by the Chinese hamster ovary cells, and it works by inhibiting the interaction of TNF-alpha to the cell surface of TNF receptors, which are TNFR1 and TNFR2, hence disrupting cytokine-driven inflammatory processes. This drug is also effective to cure conditions like rheumatoid arthritis, psoriasis, and psoriatic arthritis. Adalimumab's similar structure and function with naturally occurring human IgG1 results in its excellence in specificity for TNF-alpha and minimal immunogenic potential. Adalimumab also allows patients to self-inject the drug at home after appropriate training, which can enhance patients' convenience and autonomy. Nevertheless, it is an expensive drug and it might suppress the immune system, increasing the risk of infections. Golimumab is another fully human monoclonal antibody. They're created using mice that were immunized with TNF and genetically modified to express human IgGs. Similar to adalimumab, the heavy and light variable chain regions of golimumab closely match the amino acid sequence found in humans. It is a highly stable human monoclonal antibody, and its Fab region binds specifically to human TNF, both soluble and membrane-bound TNF, reducing TNF circulation and its binding to receptors. Golimumab can be administered both subcutaneously and intravenously, and just like the other anti-TNF drugs, golimumab can be used to treat rheumatoid arthritis, psoriatic arthritis, and ulcerative colitis. Last but not least is certolizumab pegol, which is also used to treat conditions like rheumatoid arthritis, psoriatic arthritis, and Crohn's disease. It is a recombinant humanized monoclonal antibody that binds and neutralizes TNF-alpha and inhibits its signaling to its receptors with a polyethylene glycol or PEG attached to its antigen binding fragment. This drug lacks an Fc portion, hence it does not cause antibody-dependent, cell-mediated, or complement-dependent cytotoxicity, making it different in molecular structure compared to the other anti-TNF drugs. In addition, certolizumab pegol preferentially and more thoroughly enters inflammatory tissue than non-inflammatory tissue, unlike infliximab and adalimumab. This is most likely due to the pegylation of the molecule, although the extended presence in the tissue could also be due to the absence of Fc receptor-mediated recycling of the Fab.